Okay, we're going to start off with the feet region. So we're going to actually extend the toe if you need to. Or you can flex the toe, bring the toe down. Or you can perform abduction, so it's away, do that kind of stretch. Or you can perform abduction, you can stretch it out. One goes in one direction, one goes in another direction. So you're performing abduction and extension and flexion in those regions. Another technique, especially if they do have like another technique if they have turf toe problems, let's say sprain their toe really bad and it's been past 48 to 72 hours, what you can do is actually traction and twist in different directions then. Or you can traction, twist the other direction, and just hold in those regions. I myself, a few years ago, I developed that, and so that's one of the better techniques for me for relieving it. You can also put your fingers in between and stretch them out that way too. And for some people, you can actually put most of your fingers in between and stretch out that way then too. And you can also go in different directions if you need to. Okay, next technique, what you can do is grab the foot here. One can go this way, the one can go this way, so you can do like a snake bite, twist in one direction. So if they have any arch problems, and people believe that this is your sole, so everything starts here as much as possible, and it works its way up. So if you're having problems in your feet, you might have problems in other areas of your body. So take good care of your feet then. Again, just twist in different directions then. You can also just do flexion of all the toes or extension of all the toes in these kind of directions. You can actually put your forearm underneath the Achilles tendon region and compress. And if you need a little bit more support, lift it up a little bit and then stretch it out then. But just again, make sure they're not having a lot of knee problems for the stretches, because it all relates into those regions. Next technique, you can actually compress like the bottom of the foot, any region, and just squeeze around. Or you can actually like pray for pain. So you can interlock your fingers and compress that region too. Is it stretching? Mm-hmm. And remember, ask them every now and then again if it's stretching or not. It gives you permission to talk when you're performing stretching on the client. Next technique, you can hold the shin region and make sure it's not on the tibia bone. So it's more on like the tibialis anterior region that you're putting a lot of pressure. So you're going to compress it and perform dorsiflexion. So it's really great for the calf region, especially if they are having a lot of cramps in those regions. Or you can perform plantar flexion, bring it down like this. And if you want a little bit more of a stretch, compress it here. But again, not on the tibia bone, compress, bring it down, perform that stretch. Or you can have a foot on top of the foot. If you need to, you can just use your forearms because it's not as much pressure compared to your hands. It's a little bit softer, then perform the stretch if you need to. And again, look at my body mechanics. You want to get at your back as straight as possible when you're performing this. So you might have to get down a little bit or get on the table to compensate your body mechanics during the treatment. Another technique we can perform, I'm going to push into the shin region and then inversion. So it's actually stretching out the peroneus region. So if they have a lot of chronic sprains, that's the region where I'm going to stretch. Or you can pull here and stretch out the tibialis anterior region. So pull it towards you and push this way. This is performing eversion outwards, okay? Another technique, hold the heel region, the top of the foot, kind of like a ballerina. Another technique too, you can actually interlock your fingers and just compress the heel region. Reflexology, this is the area that relates to low back problems, you name it, but it usually gives a lot of relief in those regions. It's usually kind of hard to get a lot of pressure on the heel region with the calcaneus, medical term. So you're just compressing that region just to point a little discomfort then. Okay, next technique, cup the heel, perform dorsiflexion, compress the quads, but if they do have a lot of problems in their knees, this is not the best stretch for them. So you can bring it up, give a stretch that way then. You can also perform like a snake bite if you need to on any regions, but if they ever have any tingling sensation, again, stop that stretch then. Okay. Next technique, we're going to perform traction on the leg. So you can cup the heel and on top of the foot and pull, especially if one leg is a little bit shorter. And it doesn't mean that the leg is shorter. A lot of times it's just contracted muscles in the hip region that are contracting the muscles to bring up the hip. You can also stretch and twist in different directions and hold. And you can even bring it out in different directions too. Okay, next stretch that most everybody knows is stretching out the hamstrings. You bring the foot up like this, bring it to the point of resistance. And if you think if the leg is going up, say the leg is going up like this, they're trying to overcompensate, what you can actually do, ask permission to get on the table, and put your foot over that region so the leg will not go up there. So especially if they're wearing like a sports bra and shorts, or t-shirt and shorts, or even relaxing clothing, it's easier to get up on the table then. But if they are in clothes, just get permission, definitely. Next technique, going to put the foot right at the anterior deltoid region. Hold the quad, flex the knee, flex the hip. And as you can see, she's pretty flexible. The average person is probably going to go about here then. Next technique, I'm going to put the foot right at my hip, hold the quad, and externally rotate, and hold that stretch then. And just try to remember not to put a lot of pressure on any bony areas that you feel, because you're more likely to bruise them in those regions then. Next technique, same thing, but what you can do is you can actually walk it up. And then every now and then you want to ask them, are you feeling that stretch?
Yeah.
Okay. So the thing is, if they're not, let's say I was over here, and are you feeling that stretch? No? Then just talk to the client then. Is that a little bit better? And watch for the breathing patterns. If they ever hold their breath, or if they tense up in any area, you know you're stretching it out too far then. So then you can bring it back to neutral then. Okay, next technique. You can bring it here. You can press the hip, bring it over. And also, it actually works better to be on the other side of the table. This for demonstration purposes, I did it the other way. So compress around the hip bone, the ASIS, anterior superior iliac spine there. Compress it, but not on the hip bone, and then bring the leg over them, just to get that good stretch then that way then. A modified version, compress the hip and bring it over. But as you see, the foot is not over here at all then. So it gets a little bit with the piriformis, the gluteal region, the tensor fasciae latae muscle here. So it helps stretch out that, especially for runners, they need this area stretched out. Okay, next technique, I'm going to put the foot, make sure it's not on the patella here, aka kneecap. So I'm going to compress the opposite hip and bring it down. Get a good stretch that way. Or you can do a modified version right here. Compress the hip and bring it down. So every single stretch is a little bit different, but it stretches a little bit in different areas each time then too. Okay, next one. You just bring the knee to the chest region. Remember, if they're cheating, you can compress the quads and then perform the stretch. Let's say they're cheating already, like this. You're performing the stretch and then pushing it down. You're not getting as good a stretch. So it's always better to actually compress this area and then flex the knee like this then. Next technique. Bring it over here like this. Bring it over. Okay. This gets more of the TFL region, the piriformis, the gluteus maximus region. Or you can actually put it right on your hip bone and bring it over. Get a good stretch. Is that stretching? Mm-hmm. Good. Okay. Next technique, you can actually perform flex the knee and laterally rotate like this. Just ask permission to get up on the table then. You can compress it like this. And if you need to, you can compress the side of the knee and the hip. Just do different areas. Or the adductor region, compress that area. And if you want a little bit more stretch, bring it up as much as you can too. And perform that. So especially if they have groin injuries, groin problems. Remember, if they do actually have any of those kind of problems, perform rest, ice, compression, elevation. Try not to do any stretching in the first 48 to 72 hours during an actual injury then. Next technique, bring it here, cup the heel, perform dorsiflexion here, and bring it over. And if you need to, if they're cheating, you can push it down on the quad then. Okay, next technique is compressing the quad and bringing it out. Okay, remember before we did the hamstring stretch like this, but now we're going to rotate it out to get that stretch. You can also perform adduction. Just right at the knee region, put your hip there, and just walk the leg up then. Is that stretching? Mm-hmm. Okay. So they can just maintain and hold that. And again, all these kind of stretches will be held for a lot longer in the real world. Okay. Next technique, bring it over here. I'm going to use my arm as a lever. So I'm going to bring it down like this if you need to get that stretch in that region then. Next technique, I'll come over here for the glute region. And just have them lift up a little bit. Put your fist right underneath the glute region. You can just have it relax in your hand and try to push up and push the quad down at the same time then. And slowly relax. Next technique, you can actually pull up right in the transverse abdominis region. Compress the hip and pull up. It'll stretch that way. You can also pull up on the glute region and kind of rotate the leg out to get that kind of stretch too. Next technique, you can actually bring the legs off the table, like this, and like this, and rotate it out. And if you want to do an active assistive stretch, what you actually do is you have them hold on to the ankle. So you just do one at a time if you need to. So if they need a little bit extra pressure, you push it down on that region too. So it's a really good stretch there. Okay, now bring it back to neutral. Okay, next technique, what we're going to do is we're going to have her slide her hips over to the side of the table, but her head in the same area, just so they feel more comfortable. So the hips right over here. So then you can just make it straight, compress the hip, and bring it down to get a good stretch that way. And you can also rotate it if you need to too, to get that stretch in that region. And this actually works a little bit with the psoas region, also with the quads, stretching out that region. And the psoas, that's the main postural muscle in that region. Okay, you can bring it back to neutral. Okay, next technique, here, you can rotate it, and then compress in these regions. And again, all these stretches are not for everybody, but just giving you different opportunities for different types of stretches. Okay, next technique, you can bring it up. You can bring both of them up. Okay, this leg over here like this. What you can do is you can compress right here, or you can compress the hip and then bring it over this way then too. Okay, next technique. You can flex the knee. We're going to perform dorsiflexion of the ankle. And just compress down. Okay, again, if you need to, you can compress the hip and perform the same stretch then in those regions. Okay, next technique, you can actually take both legs and compress different areas. You can even bring both of them up and hold here. It's a good muscle test too, just to see if one has a little bit more range of motion than others. Okay, next technique. We performed this already. We're just going to mix it up a little bit. I'm going to put my hip right in the knee region. I'm going to push down on the knee and compress the adductor, the quad region. Feel it there? And if you need to, you can extend the leg just by rotating your hip a little bit. Try to get that leg straight then that way. Bring this over. Compress the anterior deltoid region and bring it over here like this. So you can stretch more of the back region. So it's a total twist then. Okay, next one, what you can do, you can actually have them kind of hook onto the table here. A little bit more resistive. And you can perform different stretches like this, or you can be in this region here. And just walk the leg out this way. But it's just helping out a lot this way. But just make sure the knobs on the, if you have a massage table, that's not pushing into that region, because otherwise it's going to be kind of tender in that region then for them. Okay, you can go back to neutral. Next one we can do is go underneath, low back, just lift it up a little bit. Another stretch, place our hand, and then go underneath. And then lift up if you need to. But remember, lift more with your legs as much as you can then, okay? But, so if they are having the back problems, put this on the stomach region. Bring the foot over here like this. Bring it like this. Compress the hip and push down a little bit. Make sure you perform this slow. And if they do feel any tingling or anything else, stop the stretch then. You can also compress the opposite hip or even the shoulder if you need to, if they're cheating a little bit there then. All those different areas. And do you think you're flexible enough to perform both like this? Okay.
Oh yeah.
So just keep it like this. Bring this one over here like this. Okay. Then you can actually compress more of the quad region, upper quad, or even the hip region. Remember, any tingling, stop the stretch then. And you bring it out slowly with all the stretches. Okay, next technique we can do is ask permission to sit on the foot, and also we can do too, let's say they actually have oil on, you can put the sheet over this, sit on their top of their foot, and lean back. Sometimes it helps the quadriceps region, or if you're not getting a good enough stretch, have them hold on to the end of the table. You feeling it there? Mm-hmm. Okay. And then you can also just do compression stretches too if you need to in these regions. Or you can sit on the foot and externally rotate the hip a little bit, get a little bit more stretch, or hold the hip and perform that stretch then too. Bring the leg over here like this. Push the knee away from you. Pull the foot towards you. You feel that stretch?
Yeah.
Right there? Okay. But you see, felt a little resistance, but again, ask permission if it's stretching or not then, okay? And bring it back. Next one. And bring it over here. And put your hand underneath this region and twist. You can also perform it with the legs off the table. Just make sure the hips are on this region so you can get more of a stretch in the quad region. So you can actually compress the hip, bring it down to get that kind of stretch. You can even bring it over here and push it down this way too. So a lot of these stretches you can actually perform off the table, that region. Okay, you can also perform it like this. Here, compress the hip, stretch out the groin region. The stretching there. Okay. Okay, next one. You actually put both the feet together like this. Depends how strong you are. But you can actually push just one at a time if you need to. You can even walk in the feet too. Okay, next technique. Put both the feet together like this. And hold them together. Just walk it in. And you can also ask permission to give a little bit more leverage for yourself. Is that stretching?
A little.
A little. Right there?
Yeah.
Right there, okay. And again, if you need to, you can actually have them actually give a little push too. Right there. Okay. And again, bring it out slowly in those regions. Next one, we're going to cross it over here like this. Bring it up. Bring the knee towards you. And the other leg away from you. And bring it back to neutral. And you can also hold the quads. Stretching here. Okay. So it's a little bit more forced stretch for the gastroc, soleus, and a little bit of the hamstring region too. But again, remember, if they're cheating, you can put your foot over your ankle region. Okay, next technique, you just bring it over here like this, and just walking in different directions, just so where there's a little bit of resistance. Okay. Again, you can even use your hand. You can push down a little bit. And if they're so flexible, you can actually have them scoot to the edge of the table, but just their hips, but not their upper body, so they feel a little bit more secure, so it doesn't feel like they're actually going to fall off the table then. And usually with stretching, you want the table a little bit lower than a regular Swedish massage, just because it's more stable. The lower you get the table, the more stable it is. The higher it is, it's less stable, and you can actually flip it easy too. So with this, it's really beneficial to have it so you can actually get up your knee on the table, really comfortable for these kind of techniques. Okay, next technique, put your hand in here, perform a leg cracker. So compress this area, more of a compression stretch. Is that okay? Okay. But she jumped a little bit, so the thing is, sometimes it might be a little uncomfortable. So the thing is, just back it off a little bit. So, but once you're in that great stretch and you don't want to move around a lot more, but it's a little bit painful, just back off of it a little bit then. You actually put your pinky in between the middle finger and the index, and 2 fingers in between the index and the thumb, 1 pinky in between the ring and the middle finger, and another finger in between the ring and the little finger. So then you can just compress it that way then. So that's another form of stretching in that region. Another technique, you can actually stretch it out like this. If you want a little bit more stretch, compress and stretch. Okay, another technique you can do is you actually interlock your fingers and compress in that region. Or you can compress the extensors. The extensor is the hairy side of the arm, flexor is the flat side of the arm. Compress that region, form an extension there. Or you can compress the flexors, the flat side of the arm, stretch up that way. Or you can just bring it off the table a little bit, compress the flexors, and stretch it out that way then too. Another technique too, just a little snake bite in this region, just helps relieve a lot of tension, especially for therapists. Next technique, I'm going to compress the palm region with my thumb and wrap it around, form that kind of stretch. Next technique, their palm on the table. You need to lift up the fingers. You can either do one at a time or stretch all of them at the same time if you need to. Just see which one's more flexible that way. Okay, go to this side. Okay, next technique, flexion of the elbow. Stretch that area out. Actually helps a little bit with the tricep region. But a better stretch for the tricep, just make sure you perform this slow. The palm on the table. Hold the elbow region. And bring it back now. Is that stretching? Okay. And again, this looks awkward, but it's a great stretch, but just make sure you perform this one slow then, just to make sure. Then come out of it slow. Okay, next technique, I'm going to go underneath the shoulder region, hold the extensor region here, and lift up if you need to, or just compress on the deltoid region to get a little stretch that way. Or if you're still not getting a good enough stretch, perform traction and just lean back and stretch that region out then. Another technique, you can bring the arm over the table like this. Okay, you can compress the deltoid region here or the teres region here. Just compress it and then push the arm down then, okay? You get a good stretch that way. Is that stretching?
And neck.
You okay? Right there?
Yep.
Okay. So just a little bit more stretch then. Another technique, you're going to have their hand underneath their head. Okay, so you can press the pec region, stretch it out that way. Okay, especially if your shoulders are more into rotated, if you're at a computer desk all day long, it works wonders to help stretch that area out. Also, you can perform with both hands behind the head. You can either compress the deltoid region here or the bicep tricep region, stretch those areas out, works really nice, or the elbow region, but make sure you don't put a lot of pressure right on the elbow, any bony areas then. Stretch it out then. Okay, next one, put the arms to the side. I'm going to compress the pec region here. Just push down, get a good stretch that way. And also, again, if your shoulders are more rotated in like this, it'll stretch that area out, because this is a big problem for most people in this region. Next technique, what you can do is put your hand underneath the rhomboid region, in between the spine and the scapula. You can ask them to just lift up a little bit, compress here, and then push the shoulder down towards the table then, to get a little stretch then. Okay. Next technique, just going to lean back. You can twist the arm if you need to, or if you need a little bit more stretch, you can actually have them hold on to your wrist. Right here, you grab my wrist, and I hold on to your wrist. And if you need to, you can push in the shoulder, do a little traction that way, or you can just lean back and perform that stretch that way too. Also, you can perform with both at the same time, and when they interlock, you're not putting so much pressure on them. That's what's so nice about it then. Another technique too, you can just bring it down. Is that stretching there? Mm-hmm. Okay. So let's get in more the pec region too. Okay. Next technique, you can compress the bicep region, push up, keep flexing, push, 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 then extend to get more of the fascia region, a little bit of stretch that region. You can also compress the bicep, push away from you, and then pull towards you, a lot of rotation. Or you can even compress more of the pec minor region, compress, and then bring it this way to it. And you can even compress, pull towards you, and immediately rotate it if you want a little bit different stretch in those regions then. Okay, next technique. You can have them hold onto your shoulder here. You grab onto their shoulder, compress their hip, and bring the stretch this way then. Sometimes a little bit more comfortable, a little more stable for that if you need to. Otherwise, you can just have them lay there and just bring over the stretch that way then too, okay? Okay, next one. You can bring the arm over here, across the chest. If a person has large breast tissue, just be aware of that. Make sure you're not putting pressure on the neck region. And on the breast region, sometimes it might be uncomfortable if you're holding it there for a while then. So you can go on different angles. You can even traction and twist in different regions too to get that good stretch if you need to. Okay. Next one, you grab the vertebral border of the scapula, and you can just pull up. You can pull up on you can compress the hip region and just hook your fingers underneath that region to get a little stretch if you need to. Okay. Next one, you can put their arm underneath their back. Okay. Then compress the pec region. So stretching.
Mm-hmm.
If you want, you can just push it in a little bit, but just make sure you're performing this slow. Okay, and then you pull it out slowly. And if they're really flexible, you can actually have them put both the arms underneath their backs. And then compress that way then too. Okay. Just one quick second. Okay, next one. Arm cracker here. So compress, rotate. You can go at different angles if you need to. But the thing is, this is an endangerment site, so that's why I'm not putting a lot of pressure with my fingers or anything else in this region. So the thing is, you can also compress here with your forearm and then flex. So it's more of a compression stretch. So it's a little bit different than the regular stretches, but it's more of a compression stretch. Perform radial deviation. You're holding it here and bringing it towards you. So the thumb region, so this is the radial bone. So that's that. So it's stretching out the ulnar region. Or you can compress it again and push it away from you. So it's stretching out the radial region then, okay? Some people call it abduction of the wrist when you go this one, and some people call it adduction. So either this is ulnar deviation, radial deviation. Okay, next one. You're gonna go underneath the shoulder, right in the rhomboid in between their scapula and their spine, pushing up and pushing the arm down then at the same time. Next one, you can just have them rest their hand on your shoulder, compress, and you can even have them do an active assistive, try to reach and pull up kind of thing, but I'm going to compress down at the same time. Feel that? Mm-hmm. So again, in the pec region, it works wonders. Now I want your shoulder off the table here, but your hips right here. So just scoot your body over in this region. Okay, so you can compress the pec region and pull it down. Is that stretching?
Yeah.
Right there, okay. And you can even do a little twist if you need to. But again, they feel a little bit more comfortable if their hips are in the center of the table and their body is over here, so it's less likely to flip over the table. Okay, if you can scoot that back in the middle. Okay, now with the head region. Okay, we're going to do a traction. We're going to hook our fingers underneath the suboccipital ridge here on both sides. Compress it and pull. Feel that? Mm-hmm. Okay. This sometimes helps with headaches. Okay, next one, you put your hand underneath the back of their skull, one on top of the head, and just lean back this way. So that's another traction technique for that too. Another way to perform it, I don't like this as much, but some people use it. Compress underneath the skull, hold the jaw. Do it okay? Mm-hmm. Okay. And again, make sure you're not putting a lot of pressure right on the neck region when you're performing that then. Okay, next technique, you can actually compress more in the TMJ region and then have them slowly open up their jaw. Okay. So you can have them perform the stretch a little bit too. You can also just hold down the jaw and have them try to lift it up. Okay. Relax. Okay, next technique, we're going to compress here. Make sure you don't cover the ear because that's just a weird sensation. Push in the shoulder and stretch. So you're pushing in both areas. And if they're too flexible, you're going to push their shoulder down on the other side to see how much more range of motion you get just by that then. Next one, same kind of idea, but you're going to rotate it. You're going to push this way and push this way for the stretch. Okay, next one. I'm going to compress the shoulder region like this, push it down, and rotate in different directions. And if you want more of a stretch, you can lift up your forearm and stretch it out that way too. Stretches out the scalene muscles a lot, especially those are considered breathing muscles, or for thoracic outlet syndrome. With that, it gets a tingling in the last two fingers, so it's getting impinged there. Okay, next technique, I'm just going to flex the neck. Sometimes you can even feel this down to your mid-back, so it gets the traps all the way down. Another variation, you can actually cross your hands on the pec region, cross, cross, and stand up and flex in there too that way. You feel that?
Mm-hmm.
If you need to, you can just kind of rotate a little bit too. A little bit different stretch each time then. And slowly let it go. Okay, another one where you can actually do is have their shoulders off the table a little bit and their head off the table a little bit too. Have them scoot down towards yourself. A little bit more so the shoulders are off. Okay, right there. Okay, with this, what you can do, just make sure you ask permission, but you're going to put your hand right here in the sternum region. You're going to compress, push, keep flexing, push, 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 then have them slowly let their head drop. And then just push out that way and do the stretch. For the platysma region, also the scalenes, a little bit of the sternocleidomastoid. Another one, you can compress the pec region and bring the head off the table that way in those directions then. Or you can just push the head down and see she's really flexible, so you actually have her scoot even more my way. There you go. So this is not normal, okay? But some people are very flexible, so just make sure you perform it slow. You can even just rotate in different angles. So this is better after you've seen the client a few times. They might feel a little bit more comfortable with their head off the table like this then. Okay, you can have them scoot back on the table then. Okay, also with the ear, sometimes if they have like swimmer's ear, so they have some fluid built up, compress the side here and put your finger right in the earlobe and just pull in different directions. Sometimes it helps drain it a little bit, or you can actually pull it out a little bit. Or just different areas then, okay? Okay, next one, you can actually just hold your finger on top of the ear, below the ear, and just pull back then. Sometimes helps with TMJ problems also. Another one, seems weird, but actually stretching out the hair. So you can actually compress the top of the scalp and just give a little tug on the hair then. Just get a little stretch and just do it in different areas. Or you can even separate a little bit, do a little stretch that way with the hair. But just look at it as the hair as an extension of the body, so it's part of your body then too. So just make sure you incorporate those as much as you can. You can also go underneath the sinus cavity and just lean back, okay, lean your body back, stretch that area out, or you can compress and pull it down then too. You can also compress the side of the cheeks in those different directions, and also the forehead, stretch that out. And sometimes this helps with headaches. You can actually interlock your fingers and compress the top of the head then. Okay, now what we're going to perform is the posterior side of the body for stretching. And what you can actually do is just compress the arch region with your knuckles. And a lot of stretches that you perform on the feet, on the anterior, you can actually perform on the posterior side too. So you can bring up the toes, extend the toes, flex the toes, abduct the toes, flexion, extension, even in between if you need to, and stretch it out that way. Okay, you can also do like the snake bite. This is actually a little bit more comfortable in this kind of position. You can just go in different areas. You can also go like a ballerina, interlock your fingers and stretch it out that way. Okay. This is one of the best ones for the calf region. So if somebody has a lot of cramps, they're having a lot of problems in this region. Some people will actually hit that area. I don't advise that the first time. So what you can do is just compress and stretch out the gastroc, the soleus region. And if you're not getting good enough stretch, just squeeze that area, of course, and just lean your body weight down then. Just Just get a good enough stretch. You can also push into the gastrocsoleus region and perform plantar flexion. So it stretches out the tibialis anterior region. Okay, you can also go in different directions. Eversion this way, inversion this way. Stretch out those regions too. Okay, you can even do a little traction when they're in the prone position. And just twist it if you need to. Next one we're going to do is flex the knee. Do a stretch like that. So it's actually stretching out with the quads. And sometimes the compression stretches, sometimes it stretches out those regions too, even though the muscle's not being stretched. So you can also perform plantar flexion like this. So stretching out the tibialis anterior and also the quads. If you need to, you can bring it over the side. And again, this is more flexible than the average person. So again, with any kind of stretching, make sure you're going slow into it as much as you can then. Okay, next technique, we're going to rotate it out, put it right in the popliteal region behind the knee, and try to go a little bit superior to that. Compress the hip, and then push down then to perform that stretch. And you can also perform plantar flexion during that time too then. And sometimes with stretching you might hear a pop every now and then. Don't be alarmed, it's normal. Okay, just go really slow though, okay? You can also rotate it and compress, or you can even do a snake bite. Push one way, one the other way then, as much as you need to. You can also go the other way too if you need. You can also, again, ask permission to get on the table. You can actually perform both at the same time. Bring it out a little bit too if they're a little bit more flexible in those different directions. Next one, you can put your elbow into the glute region, lift in the knee, and just lean your body weight back as much as you can. Compress and lean back. Perform that stretch. Then you can also bring your hand over here, compress the glute region. So you're pushing down here, lifting up with my elbow here, and pulling towards like this, all at the same time then, to get that type of stretch. Next one, rotate it out. Okay, compress the hip. You want a little bit more stretch that way. So it's stretching out more the inguinal region. So you get in the groin region, the pectineus, the adductors, all those regions then. You can also compress the hams and pull towards you. You can also compress, pull towards me, and push this away. So a lot of times with the hamstrings, if they have tight hamstrings, sometimes it equals low back pain. So the thing is, don't concentrate just in the low back region. So hamstrings, the glute region, you name it, other areas too, as much as you can. Okay, next one, right here. And then the average person, it's going to be hard for them to perform this. Make sure you actually push down. Is that stretching there? Yeah. Okay. And you can ask permission to get up on the table. And just hold the feet together with your knees. And just compress down in different areas too. And also the glute region too if you need to, okay? You can also compress the low back region. Hold onto the knee, compress, stretch that out. Remember the kidney region, the floating rib, make sure you do not put a lot of pressure straight down right there. And if you want a little bit more twist stretch for that, the opposite side. So this hand goes this way, this hand goes this way. Is that stretching? Okay, next technique, you can perform adduction. Abduction, so you bring it, walk it with your leg, and hold on to the adductors and the hams, and just keep walking until you get that good stretch. Then you can bring it back to neutral. Then you can also bring the leg underneath like this, your hand underneath here, hold on to the low back, and push down on the shoulders and lift it up if you need to. So get that good stretch in those reaches. You can also just compress the glute region, stretch it one direction, or compress the glute region, stretch it another direction. You can also have them bring the leg totally over like this and pull their hip towards you and push their hands away from you to get that kind of stretch. Next one, just make sure you ask permission to grab the hip bone right here. So we're going to hook it, going to compress the low back region and lift up to get that kind of stretch then. You can also compress it here and compress the hams and lift it up that way too. Okay, now we can incorporate the arms into it. Have this arm. Have them hold on to your wrist. Compress between the scapula and the spine here, compress. Pull the arm towards you. You can even pull it up if you need to. Just make sure you're performing it slow. Then you can actually have both arms at the same time. Put your arm here, compress the back. I'm not putting pressure on the spine. Lift it up that way. And again, you can go at different angles to get that stretch if you need to then. You can also flex, elbow, and bring towards you. Those kind of directions. Next one, you can compress the glute with your knee. You can even have them help out to get that stretch going then. Okay? And totally relax it. Also, you can just hold on to the hip, just lift up the shoulder. Next one, I'm going to have my hand on the deltoid region. Then you can rotate it around. Have their hand, for the next technique, have their hand on their head, compress the mid-back and lift up on the elbow to get that stretch. Next one, have both of their hands interlocked behind their head. Just lift up the elbows to get that stretch. Otherwise, you can put your hands in between here, compress, and lift up. Is that stretching? Okay. You can even twist in different directions if you need to for that. With the arm, just like we did when it was supine, have them hold on to your wrist if you need to, and twist in different directions. Compress it. You can even push into it. You're doing the stretch. Next one, palm on the table. And stretch this way. Next one with the head. You lift up their head. Stretch this way. You can even go at a different angle if you need to. Different angle, bring it up. Okay, next one, you can pull the suboccipital region here and traction it. Also, you can push in the shoulder and pull the head towards you. Get a good stretch that way. Another one for the back region, you can just compress right into the iliac crest, the hip bone, pushing into that, just bringing it up to get a good stretch that way. You put the arm behind their back, bring the stretch this way. Next one, put the arm over here like this. Pushing into the elbow and pushing down to the shoulder. You feel that? Okay. So now we're going to perform with the legs. What you can do is you can just have them get in a relaxed position, whatever they feel comfortable with. I'm going to pull the leg towards me, compress the hip. Feel that? You can also perform, have the leg straight as much as you can. Compress the glute region and lift it up. That's stretching.
Yeah.
Okay. You can also lift it up and just bring it at different angles. You can use your shoulders, a little bit of a rest if you need to, for the side stretching. Okay, next one, I'm going to bring the lower leg, I'm going to push it up this way and compress the glutes towards the table. Okay, then you can just bring the leg over here like this. I'm going to bring the arm off the table. I'm going to push down here and pull the hip towards me. Get a good stretch that way. Also, if you need to, you can bring the leg off the table if they can handle more, and push the leg down towards the ground to get that kind of stretch. You can also perform the stretch with the top leg over the bottom leg and the shoulder over here. And bring it over here like this. So you're pushing in the pec region and you're pushing the glutes away from you then to get that stretch then. Okay. Bring it back to neutral. Bring the arm over the head, compress more the teres region. Compress down and push in different directions. Or you can push into the infraspinatus region and bring in different directions. You can even flex the elbow a little bit. Okay, next one, arm totally over the head like this, leg off the table a little bit. So you're just getting this whole area then, just pushing down and away from you then, as much as you can. And if you want a little bit added support with any of these, remember they can help out. They can actually hold on to the headrest a little bit and get a little bit extra stretch, so it'll be active assisted stretch. Okay. And with the head, you can actually bring the head up, or you can get in this kind of position, bring it up here. Next stretch, you can bring the arm behind the head, or behind the back here, push it down towards the table, bring the neck in different directions then, to stretch it out as much as you need. Next one, I'm going to grab the bottom arm, have them hold on to my wrist, the wrist, there you go, and I'm going to push the glute away from me. That's stretching.
Mm-hmm.
Okay. So you're getting all those different angles in that way then, okay? Okay, you can also perform like a traction. Hold the skull and pull towards you as much as you can. We're going to have her just lean forward and compress. Great for the hamstrings. Get those stretched out. And let's say she wasn't that flexible, had it like this, you could actually wrap a towel around there and actually stretch that way too, so you can get a little bit of the gas rock. Okay, next one, you have your hand, just one hand behind the head. And bring it around. Stretching.
Mm-hmm.
And you can even have your arm underneath and double stretch. Okay, next one. Rotate one out. Just have them lean forward, stretch, and just compress in different areas. They need extra stretch then. Okay. Just have both of the legs off the table, like this. Okay, and just have them lean forward, and just compress different areas then. Need to. Okay, and have them sit up. Okay, you can compress into the back region, grab the arm, stretch that way. You can also bring the head to the side, make sure you don't cover the ear, and push down the shoulder at the same time. So if somebody's shoulder is a little bit higher than the other, so that means that muscle is more contracted. Also ask permission to get up on the table. Use your forearms and push down into the shoulders. I'll stretch out the levator scapular region, the traps. Next one, you have the arms behind. Bring the arms up if you need to, or in different directions, or just one at a time if you feel a little bit more comfortable with that. Next one, you can push the head down, push the shoulder away. Okay, next one, you can hook your thumbs underneath the suboccipital ridge and traction up then, okay? To get a good stretch that way then. Also, you can push into the shoulder region and pull the head back in different directions. Just twist a little bit. Remember, always slow in, maintain it, slow out with any kind of stretching then, okay? Okay, you can also just grab the shoulders, just twist them that way too if you need to. Just go in different angles. Okay, put the arm behind the head. Pull the body towards you. Push the shoulder behind the head. Stretch out the triceps a little bit. You can also have them rest your arm. Stretch out the head this way. Again, you can go at different angles, different directions, those kind of things.